Down to this week 3 of the Impact Accelerator, part of the full learning cycle of the Movement for Immunization Agenda 2030. If you don't know what all these things are yet, well, stay tuned. We'll be explaining it all for you and very soon. So 1 minute, 22 seconds. I'm here with Charlotte and Boo as every Monday, and together with many members of the Movement for Immunization Agenda 2030 from all over the world, over 110 countries represented. We have some major announcements to make today, so stay with us. If you stay till the end, you will get to connect with members of the movement from your own country, so you don't want to miss that. We also have major announcements to make today, and you'll be hearing what progress people are making in what we call the Impact Accelerator. This amazingly simple process through which you can take your action plan focused on achieving a goal that makes sense to you, something that matters to you where you work, that is a priority challenge that you face, and support each other in sharing lessons learned, successes, challenges as you make progress every step of the way. See you in 20 seconds. We'll be getting started. Here we go. We're kicking off the week 3 of the launchpad of what we call the Impact Accelerator. Very simple process intended to help you make progress, tackling what could be your toughest challenge, what should be at least a priority challenge that you face. Now, for those of you who are returning members of the movement, at the end of this session, we'll be showing you how to meet and connect and talk to members of the Movement for Immunization Agenda 2030 from your own country. So we hope you look forward to that with us. We'll be with you to engage with you throughout this session. And I'm here, of course, with Charlotte and Boo, who is going to tell me who will be the first person in today's assembly to answer these 2 questions. Don't forget to introduce yourself and tell us, when did you join the movement? Was it in March 2022 when we kicked off, or was it more recently? And 2 questions: what progress have you made in implementing your IA2030 action plan? And 2, how does your participation in this movement actually help you with your daily work? Those are the 2 questions we wanted to ask. Charlotte, who shall we hear from first?
Thanks, Reda. I've invited Kelvin Safia Boima, whose hand was raised, to unmute himself. So Kelvin, are you able to? If not, I would like to turn towards Prof. Becky Tagbo, whose hand is also raised. Okay. Over to you, Prof. Becky.
Hello, Reda. Hello, Charlotte, and everyone. Thank you so much. So what progress have I made in implementing the IA action plan? I've actually made quite some progress. In what I was addressing was COVID vaccine hesitancy in my own unit in the hospital among health workers. And the first week, I was supposed to design a short survey that will take me further in determining the reasons for the hesitancy. Okay, my name is Becky Tabo. I'm a professor of pediatrics and vaccinology, and I work at the University of Nigeria Teaching Hospital. I also consult for the state ministry as well as the federal government Ministry of Health, and I also chair the WHO African Region Advisory Committee on Vaccine Safety. But I decided to do my action plan right in my own facility, in my own unit. That is the Institute of Child Health. So in the situation analysis, I had looked at data around, studies around, and done some interviews around to look at the root cause of vaccine hesitancy among health workers. And I got about 50% kind of hesitancy, and that most of the time the reason is fear, conspiracy theory, rumors. But I wanted a local specific reason and then to address it. So in my action plan, the two things I was supposed to do was to determine the context-specific reasons and then address it by sending out short messages. So my first week was to send out the survey, design the survey and send it out. And my second week was to analyze the survey. So I did, first of all, to form a WhatsApp group for my unit because we didn't have one. So I had to meet with my stakeholders, my boss, and talked with them, and they accepted the whole idea and joined me. They are my collaborators now, one of my colleagues and then the director. And so I designed a questionnaire which I sent out to the group, and they have responded to the questionnaire. I used responsive feedback in the course of that because I assumed that everybody will just take the survey. But when I sent it out, I was monitoring and discovered that even after almost a week, many people had not taken the survey, and it was responsive feedback that helped me to do that. And so I went into finding out what the matter was and discovered that some people did not have WhatsApp numbers, others did not have credit. And so we had to modify. I had to change it to both electronic and hard copy. And so with hard copy, many people now fill the questionnaire, which I entered back into the Google Forms, and then I was able to analyze it. And so what I discovered in this, my second week, was that what I was thinking was their major reason for hesitancy was not. And I was thinking that more than 50% had taken the vaccine, only to see that it was only 26% that had taken the vaccine. Amazingly, 74.1 had not taken. And looking at their reasons, I had always thought it was conspiracy theory. Everywhere around me is conspiracy theory. But for this staff, majority said they were just afraid of the side effects. And a few of them said they were just waiting, watching and waiting. And so I'm now in the process of designing customized messages, addressing the specific local reasons, which I'm going to begin to send out to them and then interact with them and then see that, hoping that with that, a good number will then take the vaccine. How does my participation in the movement help with my daily work? You can see it's already helping my daily work. The other thing it has done is that when I spoke to my boss about forming that WhatsApp group, it occurred to me that we could also use it to improve work, improve productivity. So I immediately designed a second questionnaire, which is not really part of IA agenda, but it came out of IA agenda. And that was a workplace questionnaire, asking them the challenges they have in their place of work. What do they think is the solution? Are they ready to make an action plan to also solve the challenge? And they're already responding to that already. So you can see what IA Agenda has done for me in my workplace. Thank you, and over.
Thank you, Becky Tagbo. I'd like to invite, if you'd like to further the discussion, I would love to encourage everyone here who'd like to know more about Becky Tagbo's fascinating experience to join the experience sharing session tomorrow, Tuesday or Thursday. Now, we have some major announcements today. The first one has to do with Teach to Reach Connect. We walked through Teach to Reach last Monday for those of you who were in attendance for the movement assembly. And as you recall, for Teach to Reach 5, which took place on the 4th of March, 2022, 8,584 people, immunization professionals, were registered for Teach to Reach 5. So the remarkable thing is, you may ask, well, what's happening with Teach to Reach Connect 6, which is happening on the 17th of June. And here is the number for this new edition. And we have 11,097. Now, there's one big change. It is not only immunization professionals, I'll explain that in a second, but almost 6,000 English speakers will have confirmed that they're going to try to be there on the 17th of June. I say that because so many of you still have challenges with connectivity, still have challenges with the exigencies of daily work. So that is what we're looking forward to. You can go to the Teach to Reach page. If you haven't yet, check your inbox. Chances are, if you're in the IA2030 movement, you have probably received the invitation and the confirmation of your registration. So go ahead and check that. If it's not there, you go to the Teach to Reach site on the Learning.Foundation website, on the Geneva Learning Foundation site. Put in your name, your email, and then make sure it does not go to spam. That's the main thing. And last week, if you remember, we said we would be making an announcement very soon. So here is the announcement. We have partnered with UNICEF ahead of the UNICEF and Global Partner Global event on COVID-19 vaccine demand. And I'll tell you the story of how this happened. The Chief of Immunization, Dr. Ephraim, wrote to us and said that he'd been attending and listening and paying attention to the events of the Movement for Immunization Agenda 2030. And that ahead of this, thinking through this high-level panel featuring ministers and heads of global and regional agencies, as you can see here, that it was important for him, for UNICEF staff, and for global partners to pay attention to and listen to what people in countries who work on COVID-19 vaccination, who've been tasked by their employer, by their Ministry of Health, to actually make it happen and make it work, and to make sure that communities understand what is being offered and what are the benefits. And so he came to us and said, could we work together? And I believe that this is to the credit not only, of course, of the engagement, the advocacy that we have been pushing for at the Geneva Learning Foundation, but it is first and foremost to the credit of each and every member of the movement who's taken time out of their busy schedule to attend, to share their experience, and to really show your motivation to make a difference and to make immunization reach the finish line in your country, wherever you are, whether at whatever level, whether it's in a facility, in a district, in a region or state, or if you work in the national planning team. So the sequence will be on the 17th of June at Teach to Reach. We'll be asking you to share your experience in how, in practice, you have strengthened demand for COVID-19 vaccination, how you've overcome hesitancy, how you've strengthened the confidence of the communities you serve in COVID-19 vaccination. So that is what is now on the agenda for Teach to Reach. If you haven't registered yet, I urge you to do so now. You'll see there are many other sessions. We'll go into a few of them now. So next session is Women Who Deliver Vaccines. On the 4th of March, there's a groundbreaking, a watershed event. For the first time, a collective of women who deliver vaccines at all levels, from the facilities to the national central planning level, came together and spoke in their own names, sharing their individual and collective voices of what it means to face gender barriers and to want to have the motivation to overcome gender barriers. For this Teach to Reach, we've partnered with Gavi's Zero Dose Community of Practice and with the Immunization Agenda Working Group 3 on Coverage and Equity to organize a special event in the context of Teach to Reach. And then third major session is going to be another plenary, this one focused on neglected needs of women's health, working with Dr. Julie Jacobson, Dr. Alison Krantel, and others from organizations deeply engaged, deeply committed to tackling female genital schistosomiasis, a disease that affects an estimated 56 million women and girls. You can go right now to the Teach to Reach website if you haven't to look for. But many of you stumble on the technical details of how you actually get to a session. Of course, there's a problem of connectivity. But this, what I'm showing you, what you're seeing on screen now, that is the email to look for. All right. It says, get your ticket now. Now, my colleague Minja took the screenshot. So it will have, of course, your name on it. And some of you missed the fact that this red sort of rectangle, you need to click on that or tap on it if you're on your phone in order to actually get your ticket. Now, just to reassure you, the ticket is free for country-based health professionals. And there are two steps. you first click on register when you get to the website using this email. And second, you then need to choose the ticket for English speaking country-based professionals. I'm actually going to show you how that works. Let me see. Yeah. And so here I am on the Teach to Reach conference platform. And you can see here, first of all, as I just showed you, you click on register. And then second, of course, if you're bilingual, you could go here. But most of you will go to the English, will select the English country-based professionals option. Once you've done that, you scroll down and click on continue. And then you just need to put in 3 pieces of information. So you put in your email, your first name, your last name, and click on register. And once you've done that, you then go to your email. Make sure that you haven't made a typing mistake here. You haven't made a typo, because if you do, you won't get anything. But you should find the confirmation to the event. So I've shown you in a few seconds what to do, how to do it in order to access this amazing event. You can also look, I'll share now the details of the of the full schedule in this message. And then there's one more thing I want to ask you, which is to share with your colleagues, including those who do not work in immunization, who work in other areas of health, especially neglected tropical diseases, but others who want to network with fellow health professionals. This is a unique opportunity to do that. Now, as you know, there are 3 networking sessions, and here I'm going to ask Charlotte to go to tell me who to guide me and who will be answering the following question. So don't forget to introduce yourself as always. Tell us when you join the movement, but tell us, we'll be offering 3 networking sessions at Teach to Reach. So networking, you press on a button and you're connected with another immunization professional, and you can talk to them about, of course, get to know each other, but also talk about specific themes. You can see the 3 themes up on your screen. So networking session 1, how I overcame challenges to improve healthcare in my community. Session 2, what am I doing to build confidence in COVID-19 vaccination? That's the session in partnership with UNICEF. And session 3, how am I challenging gender barriers in healthcare? Charlotte, who shall we hear from now? I think I already see someone unmuted, or almost so.
So I'm just asking those in the room to raise your hand if you want to share which session you will be joining, especially if you've attended Teach to Reach Connect before. But I'm inviting Kelvin. Kelvin, are you able to unmute yourself this time around? If not, I'll be turning towards others in the room to tell us. And I'm also asking Ajayi Patience. Ajayi Patience, are you able to unmute yourself? To answer the 3 questions on the screen, which networking session will you be joining?
And which one are you most interested in? Like, which topic, which of these 3 topics are you really passionate about and would like to discuss with other health professionals? Because that's what we'll be doing at Teach to Reach. I believe Kelvin has unmuted. Kelvin, are you there?
Yeah, I'm there.
All right. Please don't forget to introduce yourself. Tell us when you joined the movement. And then of these 3 networking sessions, tell us which one are you most interested in? Let's start there.
So I'm Kevin Chapa-Boema from Liberia. Specifically, I work in Maryland County. I work for the World Health Organization. I joined the movement last year when we completed the first course that was provided by the WHO. So the 3 network session here, they were how can I overcome challenge to improve healthcare in my community. What is okay? Networking session 2. I want to be part of networking session 2 because it will help me to see how we can increase COVID-19 vaccine uptake, and then increase confidence in the clients, so that they can accept the vaccine to be able to protect the entire population in the world. Especially for my area, that will be one of the greater things, because we're already doing something like this that we are implementing in our area. Thank you.
So, Kelvin, you're directly involved in COVID-19 vaccination right now. Is that correct?
Yeah. Right now we are really involved into COVID-19 vaccination activities in Liberia and specifically in Maryland. I'm supporting the country health team here in increasing the vaccine uptake.
And can you tell me something you did that actually helped to increase vaccine uptake for COVID-19 vaccine?
Okay. And we begin a lot of hesitancy based on rumors and myths that we gather on social media and all of what are saying around and what have you. So people were afraid to take the vaccine. So we got into community engagement, meeting the community, talking along with them, and then they share their own view, what got them afraid, and we found a way around to talk to them, to give them a practical example. If someone want to kill you, if you want to die, I think they're going to come with vaccine, no? But then they answer their own question, move around. Some people are taking it. Yeah, some people will take, but we still have a huge number of hesitancy. So we're going to move continually from one community to community, the community that have low high hesitancy. And when we talk to them, and based on our own involvement, show them the card that we in the field have taken the vaccine, and nothing happened to us over a year now. So this will take it will help everyone also fight the disease, and will reduce hospitalization. You won't get sick that much. So some people are getting encouraged and they are coming to get the vaccine. Yet then we have some little ones still existing in the corner. We continue to move further.
Great, thank you, Kelvin. Let's go to Gold David Subaru. Gold, are you there?
Yes, I am.
All right, wonderful. Please remind us who you are, what you do when you join the movement, and then tell us of these 3 sessions, which one is of greatest interest to you?
Okay, I'm Gold David Subaru, connecting from Nigeria. I joined the movement in March 2022, and I'm a medical lab scientist and a public health officer. As a public health officer, okay, I would, my interest is in, number one, how I overcome challenges to improve healthcare in my community. Well, as a public health officer, we hold health talks in communities to teach them health, diseases, infections and transmission of diseases, mostly the importance of vaccines in disease prevention. In most of these communities, we find out that there are a lot of them patronize private maternity homes or some private hospitals. And many of them just deliver their babies and go. They don't, unlike the government health centers or the government hospitals where they have a plan for immunization. Many of these private maternity or delivery homes don't have such plans. So many of their clients deliver their baby and go without a proper planning on the immunizations that the caregiver is supposed to make available the children for. So we teach them on diseases and the efficacy of vaccines in preventing diseases. And one good example we always use is something like polio. When you tell a caregiver that a disease like polio can cripple a child for life, many of them, they become so interested and they would want to learn more. And that makes them get more committed in ensuring that the children are immunized. And even for those of them that need immunization, it also go a long way to convince them on immunizing themselves, getting the vaccines for themselves. So majorly, that's what we do, and that's my interest.
Thank you, Gold David Subaru from Nigeria. Very interesting. And what would you be interested in hearing from your colleagues around how they overcome challenges to improve healthcare in the communities they serve? because this is what we'll be doing in Teach to Reach with the networking sessions. You press on the button and you'll be connected with a colleague who could be from anywhere in the world, may very well be from Nigeria, but could be from anywhere else. And then what would you like to know from them?
Okay, I would want to know how they have managed to, for those of them that have scenarios like what I described, how they managed to reach out to this population, because there are so many and scattered. So reaching out to them is like a kind of a problem. So I would want to know how they have been able to reach out to quite a good number, if they have challenge like that, if they have a scenario like that in their own communities or in their own countries, how they have reached out to them, and how they were able to get the government to get interested in this group of people, if their government is interested in it, if their government is paying good attention to this group of people, how they have been able to reach the government to do that.
So Gold, will you be with us on the 17th of June? Are you already registered for Teach to Reach? Do you understand how it works, or do you still have questions?
I have.
You okay?
I have.
Okay.
I've registered for Teach to.
All right, wonderful. Thank you so much, Gold and Kelvin. Let's move on. We have so networking is only half of Teach to Reach. The other half are the plenary sessions. So in the past, we've had literally thousands of people online connected to each other, listening to testimonials, listening to stories, success stories, lessons learned, challenges. And we'll be doing 3 plenaries this time. The first one is on building confidence in COVID-19 vaccines. That's the one in partnership with UNICEF. Second one is on listening and learning from the experience of women and men who are challenging gender barriers in immunization. That's in partnership with the Gavi Zero Dose community. And then the third plenary is leaving the topic of immunization, but very much, I know, of concern to many of you who work in health, and that is the neglected needs of women's health, specifically neglected tropical disease called female genital schistosomiasis that affects an estimated 56 million women and girls. And you'll be hearing from the FGS movement, people like yourselves who work in health and who responded to the call from the Geneva Learning Foundation to take action to tackle FGS together. So even if you don't work in neglected tropical diseases, this session should be of interest to you. Again, Charlotte, who shall we hear from? To answer the following question, which of these 3 plenary sessions are you most interested in and why?
We have a number of hands raised already. I'm inviting Adamu Galadima Dagona, whose hand is raised. Are you able to unmute? We have Emmanuel Ndubuisi.
All right, so let's see. It's really a question of who. All right, Emmanuel Ndubisi is the first one to unmute. So, Emmanuel, you have 3 options for plenary sessions at Teach to Reach: COVID-19 vaccine confidence, the experiences of women and men challenging gender barriers, and female genital schistosomiasis. Which of these are you most interested in and why?
Hello, good afternoon, everyone. My name is Emmanuel Ndubisi from Nigeria. I am most interested in the first plenary session, how we build confidence in COVID-19 vaccines. I'm a pharmacist and I'm currently working in the HIV program in Ekiti State, Nigeria. However, we are mandated to ensure we improve uptake of COVID-19 vaccines in the States. So I got involved in the COVID vaccination in Ekiti State here. So we are actually trying to improve the confidence in the people by demonstrating to them how safe the vaccines is. First, we started by taking the vaccines ourselves. So whenever we go out for outreaches and go out for demand generation, we get to show them that we have been vaccinated. I have taken the vaccines, the first dose and the second dose, and I don't have anything to worry about. So it's expected that you too should take it, and then it is safe. And then some of them come up with the fact that they know people that have taken the vaccines and then they had some side effects and unwanted effects and all that. They'll get to tell them that, hey, even if you take paracetamol, you take anti-malaria, you take any other medication, you also have some side effects at some point. Then you are sick with malaria and they give you an injection, you have pain in the site of injection. So these things are common with every other medication, not just the vaccines. So it is safe, and then you're going to feel a bit dizzy, you're going to feel some slight effects and all that, but it will just wear off with time. And so we try to encourage them and try to make them understand that it's for our protection, both for themselves and for our family members. So that is what we've been doing to ensure we improve the confidence in COVID-19 vaccine. Thank you.
Thank you, Emmanuel. So I have a question for you, Emmanuel. As you know, as I said earlier, it's the chief of immunization at UNICEF who reached out to us and said that he'd been paying attention to this movement for Immunization Agenda 2030 that you, Emmanuel, and 8,000 others are a part of. And he felt that in the context of this high-level panel with ministers and heads of global and regional agencies, that you, Emmanuel Ndubuisi, and Gold David Subaru, and others, and Kelvin Siafa Boima, and all of you who are committed, who've made this commitment to the movement for Immunization Agenda 2030, should be at the table, should be part of the dialogue, and that's exactly what we'll be doing on the 17th of June. So, Emmanuel Ndubuisi, I have a simple question for you. If you could share, with respect to COVID-19 vaccine confidence, what you are doing to build confidence, and if you were to share, if you had Dr. Ephraim, the chief of immunization at UNICEF, in front of you, what would you tell him? What would you ask of him? And what would you share with him in that context?
Okay, so I'll share with him what we've been doing in the field, how that we have been able to go to the communities and gather the individuals with some of our support staff and community leaders. We gather the individuals in the community, and then we talk to them about the vaccines. We tell them how safe the vaccine is. We tell them how these vaccines is for their own protection. So I will showcase our series of health talks, market rallies to improve confidence, and then the fact that I myself have also taken this vaccine, and this vaccine is safe and for our protection. Thank you.
Thank you, Emmanuel. So we'll see. This is the 17th of June at Teach to Reach. We're counting down. If you haven't done so yet, you can go to the Teach to Reach website on the Learning.Foundation website. Request your invitation. You can see it's happening in 10 days, 20 hours, 59 minutes, and 17 seconds. Now, it was just over a year ago that we asked this question: what is the future of immunization? We shared with you what we were learning about Immunization Agenda 2030. And now, 14 months later, we have a nascent movement for Immunization Agenda 2030, reaching 44,978 immunization professionals. And it's not only about the connections we make with you, it's about the connections you make with each other. We're reaching the end of the full learning cycle, the first one, but the end of a cycle is simply the beginning of another, as the focus of the movement is on actually moving things forward, taking the immunization agenda forward, taking your priority challenges and tackling them head on with the support of a movement rather than doing it alone in your own context. And 8,377 people responded to the call to join the movement. On the 23rd of May, we launched what we call the Impact Accelerator Launchpad. And there, more than 4,000 of you, including 2,418 Anglophones, confirmed their participation in the Impact Accelerator. So logically today, in week 3 of the Impact Accelerator, we're going to focus on answering this question. You said you're ready to take action. And it started with developing an IA2030 action plan. An action plan focused on a specific strategic priority of the Immunization Agenda 2030, a specific key area of focus if you've just joined the movement, as dozens of people have in the last week, you can still join the Impact Accelerator. You first need to complete your IA2030 action plan. Conversely, some of you who've completed an action plan have wanted to do it, have asked if you need to do it more than once. No, you do not. I'm now going to tell you exactly what you need to do. And there are only 2 things you need to do in the Impact Accelerator that do not have to do with implementing your action plan. The focus of the accelerator is very simple. Focus on your implementation efforts. You have an action plan, you set a goal. What actions are you taking? And so for the accelerator, the 2 things are, number 1, on Monday, that's today, you set the action that you're going to complete by Friday. So please do not tell us that by Friday you are going to improve vaccination coverage in your facility, district, state, or country. Please be modest, specific, realistic, focused on something that you can actually finish by Friday. You tell us, but really you are accountable to yourself. What we will do on Friday, and this is step 2, is we'll ask you, how are you doing? And did you finish your action? So if you said, for example, that you're going to present your action plan this week, did you do it? And then tell us what you learned. Tell us if there were any lessons learned, anything that surprised you, any challenges, any new challenges that you uncovered, and tell us what you're going to do next, how your action plan is shaping up. And once again, we have each week the community barometer, because part of what we ask you is to confirm that you're still active in the movement. And then we ask you to answer a few questions. And you can skip those questions if nothing really has changed. But as you can see, since the 7th of March, except for the last 2 weeks where we've had sort of very minor, let me see if I can point, very minor decreases here that are probably not significant. It keeps going up. So it's the barometer of how the community is doing. And it seems that the more you've delved into the movement, the more you've gained from it. Now, before we go into the experience sharing, we're going to have only 26 minutes of experience sharing. And so I want to highlight the experience sharing sessions that take place on Tuesdays and Thursdays. This is with Dr. François Guess, who's with us, together with Charlotte and Boo. And these are absolutely amazing sessions. If you haven't been able to attend, I am sorry for you, because these are remarkable sessions in which practitioners are sharing with each other, in addition to benefiting from the considerable experience shared by François, as well as Charlotte as fellow practitioners. So we're all in this together. The challenges may be different, the context may be different, but we all stand to learn from each other. So Charlotte has just shared the registration link for experience sharing. It is not mandatory for you to join this. Remember, this is the Impact Accelerator. We want you to focus on implementing your action plan, on making progress with your action plan. But we definitely hope that you will be joining the experience sharing session. They really are wonderful sessions. Before I go any further now, I'm going to share what you've been telling us about the progress you've been making. I haven't had a chance even to share a few messages from those of us who are watching via social media, so via Facebook. Dr. Bala Ganesa Kumar from India, who says he's here. We'd like to know where in India, Dr. Bala. Iqbal Alhaj says hello everyone via YouTube, but doesn't tell us where you're connecting from, Iqbal. Diane Salanon says bonjour à tous, a francophone. Hope you're still watching and that you do speak English. Umer Iqbal from YouTube saying, please tell us what city, country, what are you doing in the movement for Immunization Agenda 2030? And same for Mike Asua from Nasarawa State, Nigeria. Thank you, Adamu, for telling us where you're connecting from, but we'd love to know a lot more than that. And so we have a list of people who shared their progress last week. So who took time to really share detailed accounts of what progress they made, what difference it made, what they learned from carrying out specific actions to implement their action plans. And what we're going to do is with Charlotte, we're going to turn to those individuals in the room to have them tell us what progress they've made, what with respect to their goal. Did they complete their week 2 action? What surprised them about completing the action? Do they have a lesson learned, a success or a challenge to share? And what is their next action? So Charlotte, over to you.
Thank you, Reda. I'm just trying to invite Dr. Martin Mayen, keeping in mind our fairness kind of like rules. Dr. Martin Mayen, I see your name is on the honor roll. I don't know if you're able to unmute yourself to share your experience. Okay.
Thank you very much, Dr. Reda and Charles, everyone. This is Dr. Martin Mayen from Republic of South Sudan. I work at national level, and I joined the movement from the day one during the launching. Looking into the goal for June 17, 2022, my goal, going back to the challenge that brought me to this level, affect from the health facilities. And one of the key root causes was that the patients, they don't get transferred from one unit to another. For example, the clients that are coming for nutrition or OPD, they may not go for immunization sessions. And so one of the things that we got to understand was that there is no coordination among the different units. So with this regards, my goal is to ensure that the primary healthcare directors, who are the responsible people for ensuring this kind of practice, are rallied to make sure that coordinations are happening and the children who come should not miss their doses for immunization. And we believe that this is a mutual benefit. A child for immunization should also not miss to be screened for nutrition. I think the goal is to rally all the stakeholders from primary healthcare directors, county health departments, and the facility staff to ensure that this one is happening and it is being practiced so that it helps, because this is one of the key reasons, among others actually, in the health facilities why children are not getting vaccinated.
Thank you, Dr. Martin Mayen. I'm going to go now to François Gass, who probably has questions to get more specific to understand your goal, because we know you want to improve the average, but we don't know, at least I don't know where you're starting from. You probably do. François, what would you like to
Thank you, Reda. Hi to everyone. And thank you, Martin, for sharing your goal and what you're doing to reach it, or what are the actions you're going to do by the 17th, because it will take time, of course, to do better and to reach your overall goal. My question, you say improve annual coverage from 260 to 280, but you are national level, so I'm not sure I understand the small number of children you try to get. It's like an increase of 10%. And is it a drop? I'm not sure. Could you clarify your overall goal for your Penta 3 uptake? You want to go down from less than 10%, from 15% to, is this nationwide or is it a local area where you work?
This is, if you look at our role at national level here, one of the things that we do is to ensure that we analyze the data and we provide the feedback and strengthen the capacity at the lower level, so that the immunization vaccine uptake is improved. From the assessment that I conducted, I got the average uptake for Penta 3 of about 26 children per facility. We thought that this is too small. The average uptake per facility is very, very small. And I thought the best is to try to make efforts to bring it up from below that one, but also ensuring that the dropout rates, which is also currently above 10%, is around actually 15%. We should maintain it around 10% or below. So that is what
thank you. And I'm very clear now on the fact you have a 15% dropout between Penta 1 and Penta 3, and you want to bring it below 10%. what I still not clear about, if you clarify more, you are in South Sudan. What's your target population in South Sudan? I'm hearing that you want to give a target to to health facilities. What is this target of 260 to 280 uptake? What does it represent really? You mentioned 26 before, and then you move it up to 260. Can you clarify better?
Yeah, this is if you know, some of the facilities, the Penta-3 coverage could be around 300, 400. Some of them are even as low as 190 children for Penta-3. This is the so when you look at the average, the total average comes up to 260. Yes, so this is the total average.
Now I understand better. You have a look at the number of children receiving Penta-3, and you look by health facility, and you would like them to move up the average. But the average will vary, of course, from one facility to another, given the local conditions. But you don't have a coverage by facility. Are you not going to link the coverage to the current coverage in a health facility, or maybe the data are not truly available or not reliable?
The problem that I have here, that we have in South Sudan, unless those facilities in which you are able to conduct the micro plan, then you are very, very sure about the population by that catchment, by that catchment area.
So there is an unknown. That means you feel it's unknown. The target, your target by health facility is not very clear. That's what you mean.
Yeah, because the National Statistics Department doesn't give the target population by villages, perhaps also by payams, which are below the county. So it makes it very difficult for me. Unless I conduct microplan where we have conducted microplans, it's easier for you to understand that this is the target for each facility. But where you don't have, it makes it very difficult. And if you look at the ratio of the facilities with the microplan to the ratio to the facilities without microplan, is a very minimal. It's let me say 30% or 20% facilities with the microplan that you can confidently say this is the target population.
Thank you very much, Martin, because now I'm clear. In absence of coverage data, in absence of target, you have to make an assessment. You figure out that on an average, the facility have 260. This is an average that may penalize or help some. And you say you should move to an average of, your overall goal is an average of 280 per facility, irrespectively of the target population they serve. So you give them an absolute number of children. And of course, if health facility reach more children, you really have reached more, obviously more children with which was zero dose, and children drop out, needs a continuity to get the third dose of Penta. So yeah, I understand the absence of data make you give them a target as an absolute figure, but you need a word of caution with an average target, because for some facilities far easier than for others.
Yeah, and that is the problem here. You see, there are facilities which are being supported by the partners. They have good support. They have motivated vaccinators. They have 5 days immunization sessions a week. They also can conduct outreaches. So those ones, you can make sure that they're better, well placed, and that is why you are seeing these variations across from facilities which are supported by the partners and those who are not supported by the partners.
No, I understand, and of course you may have accessibility issue, dispersed population, which make it much more challenging for some health facility where they are more urban than rural. So no, I understand the challenge and the lack of data, and you try to give them an absolute number of children to reach on an average. But be cautious you should be a bit flexible, or it could be demotivating if you're really in a very complex situation.
So François and Martin, what I hear is, how difficult it can be to explain your situation so that others understand it. And I would like to ask each of you who is working on implementing your action plan to think about how you summarize what you're trying to do, what your challenge is, what your actions are, and ask yourself, is it going to make sense to my colleagues who work with you? Is it going to make sense to colleagues who may be halfway across the world and who know nothing about your situation? Once you've done that, if you can clarify things for people who know nothing about your situation, you've almost certainly clarified things for yourself. So thank you both for talking through some of the dilemmas here. I know there was, I believe it was Caroline. Let me see if I can. No. Who had her hand raised. I want to go back to Charlotte. Charlotte, who shall we hear from next?
So it was actually Christine
yes.
Yeah. So,
good.
Over to you.
Good evening, good afternoon, everyone. This is Christine Omanyo from Kenya. And I had just a concern of the presenter who just contributed. Congratulations for what you have and having the challenges. I will share that when you want to move ahead in your action plan, then you should narrow down if you are doing it as a district, or narrow down if you are doing maybe a division or allocation. So facilities that exist in a division or allocation, you bring them together and then run through them and see that how much of the target. You say that you don't know about the target. There are other ways that you can know about your target through the past, the workload that the other facilities had last year. So this year you see the country growth rate. Then from the growth rate you get to the proportion and you estimate the target for this year. So you work upon that. So I hope I've contributed something. Thank you, and over to you all.
Thank you, Christine. I don't think you introduced yourself properly other than to say you're from Kenya. What do you actually do every day in immunization? And then what is your action plan focused on?
Oh, thank you. This is Christine Omanyo from Kenya. I'm working as a vaccine and immunization coordinator at the sub-county level, that is district level.
Yes.
And my action plan, I raised up the hand just to support whoever the speaker who had just shared about the action plan. However, on my action plan, I had a target of achieving 70% of HPV-2 and 70% of measles 2. And for this week, I passed through. I was to meet the school teachers' heads. I met around 10 heads, and we enlisted the number of children who had received HPV-1 and who are supposed to get HPV-2. And then I also had two Chiefs Barasa meeting that I enlisted some children in villages who were supposed to get measles 2. So I'll be moving to week 3. My most challenge was I didn't get enough children that I was supposed to get for measles 2 who missed them, because parents who came for the meeting did not carry the books. The CHV who was supposed to bring the data went for another meeting. Thank you, and over.
Thank you, Christine. And what is your next action then?
My next action is that after listing these children, I'm going to link with the link facilities that they give the HPV-2. I have already been given the dates by the school that we expect to move to those schools and vaccinate the HPV-2. And then for the measles 2, I already negotiated with the parents who came with the books and those that I listed that were ready for measles 2. This Friday, they'll be coming to certain health facilities and they'll be giving a mobile clinic for the measles too. Thank you.
Thank you, Christine. We're not going to let you go yet because I'd love to hear François Gasse's questions for you about what you've told us so far about your action plan. François?
Thank you, Christine, and thank you for giving me the floor. Christine, I found interesting your story, and what's interesting that you I feel very interested that you move down to the school to understand really, and to the parents to really figure out what to do. I think it has been raised by many of the previous sharing experience, that listening to the stakeholder, and in the school, it's a teacher, it is a family, it is the parents, the chief, as you mentioned. Now, I want to know, what was the main concern, that the main cause for the HPV, the hesitation to get HPV-2? What's the main concern that was expressed by those different groups, and how did you address them?
The main concern for my district is that we were doing poorly at HPV-2. It was below 20 to 40% averagely. And then I wanted to know, how comes that those who received the HPV-1 are not coming for HPV-2? I realized that most of the advocacy and communication was not given to the parents. It was given to the teachers. These teachers were going on transfers, moving from one school to another. New teachers were coming in who did not have this information. So the students who were given, pupils who were given this information hesitated to tell out to their parents that they were due for their second dose. So I had to bring these stakeholders together in the same understanding, so that the people understands, the teacher understands, the parents understand, so that other children who receive the first dose are able to get the second dose on due time to the closest facility. Now, the main concern from the parents is that some did not know at all why they needed that vaccine. So I had to bring the picture on the country look on cervical cancer and the mode of transmission. And so from that understanding, now the uptake and the line listing, those ones who wanted their daughters to get the second dose increased. Thank you.
Excellent. I'm very happy to understand better your approach, and you seem to be a good manager, because you really went to understand what was the real cause of the problem, and you address them with the concrete actions. And I hope we see the results over time of your corrective action and the steps you have taken. And I think it's a recurrent thing, that to understand really the cause of the problem and to adjust to adequate communication and feedback, you need to meet all the stakeholders. If you miss one stakeholder, your program could fail, even if you have targeted the other stakeholder. And I congratulate you to have figured out why the communication program you didn't reach the parents with the movement of the teachers. So your investigation has brought a lot of important information to adjust your corrective measure. Congratulations, very interesting story.
Thank you.
Thank you, François Gasson. Thank you, Christine Omanyo from Kenya, and Martin Mayen, who is currently in Sudan. So let's see, we have some comments. So yes, so Shiba Dauda says, interesting. We'd like to know more, Shiba. What did you find interesting? This is just 2 of the more than 1,000 action plans currently being implemented, with members of the movement reporting back, sharing what they're learning as they implement, sharing what is working, what they're trying, and what is not working perhaps as well. Lessons learned, successes, challenges are all of interest to us in the movement for Immunization Agenda 2030. If you have not yet, if you've just joined the movement, or if you did not have time perhaps to do your action plan earlier, you can still join, you can still do it. You will find an email which asks you the question, have you completed your IA2030 action plan? If you have, you don't need to do it again. Please, we've had some people submit the same action plan 2 or 3 times. That's not what we want. But there are people joining, new people joining the movement every week. So this is your chance to still participate in both the action plan stage and the Impact Accelerator, which is ending on 17th of June, so do not delay. And then there are only 2 things we ask you to do to stay in the accelerator. Monday, that's today, we ask you to set your action that you will complete by Friday. So you'll find in your email, look for this green rectangle that says set your goal and action for this week. So the goal is actually what you'll achieve by June 17th. The action you will take for the week is what you'll finish by Friday. And the reason we ask you this is because on Friday you'll receive another email, this time asking you, tell us how you're doing. What happened? Did you do it? Did you finish the action that you said you would finish or not? And this is not to blame you. There is no right or wrong here. This is about you taking on a challenge that matters to you, a priority challenge for which you've developed an action plan. But this is about being accountable to yourself, accountable to fellow members of the movement. And if you need support, if you'd like to go further in the discussion, the Assembly, unfortunately, we only hear very few voices, very few of you. In tomorrow's experience sharing session and then in Thursday's experience sharing session, you'll get to go further. Now, these sessions this week are the last 2 experience sharing sessions. We won't be having experience sharing in the week of the 13th of June because of Teach to Reach. So please do take the opportunity, if you haven't been able to do so, attend at least once, or else you're missing really an important part of the movement for Immunization Agenda 2030. Now, for those of you who are working through responsive feedback, you still can, there is, I believe, one more workshop. So here, all members of the movement who met certain criteria, received the invitation to join the responsive feedback module. We will be issuing an official letter recognizing your participation in the responsive feedback module. There is a deadline to complete the module, and that is Friday, 10th of June. So that is this Friday, actually. And then the requirements are here to complete the module, including the 2 worksheets before Friday, June 10th. And then second requirement is to attend the Friday live workshops or complete the catch-up task if you have a legitimate reason for absence. This is a unique opportunity to learn with Professor K. Viswanath from the Harvard T.H. Chan School of Public Health. You know the other resources. You can continue to search for new ideas and practices in the Ideas Engine. There's mutual aid support between members. And then if you're absent from the Monday Assembly, all you need to do is confirm, let us know that you're still in the movement. Otherwise, we'll have to assume that you're no longer active. And if you have poor connectivity, we highly recommend listening to the podcast. So that's it for this assembly. But we're not done yet, because this is now the time when we invite you to connect on Telegram. And I'm going to show you. So go to Telegram, and here, this time, we are going to, let me see if I can get some music going here. Yeah, here we go. So, yeah, here. So, I'm going to go to Telegram myself here, and I'd like you to do the same. And you should have joined by now your country's Telegram group. And so you go to your Telegram group. I see there's some Francophone countries that are still talking, but if we go down here to Nigeria, if you are from Nigeria, and we know Nigeria is the largest country group. Yes, okay, I see Charlotte has already opened up the channel. We need you to go to your country team and say hello. Just say hello, or we want to talk. And then Charlotte and myself will come in and we'll open up the room, and we need at least 2 of you to join. As soon as there are 2 people in the Nigeria channel, then we will leave you be so you can have the discussion and have more people join, but we need a minimum of 2 people to join. So that's for Nigeria. But if you're, say, from, let me see, if you are from Liberia, you can do the same. All right, and you first have to let us know that you're there. So, for example, if James Tukulon or Darius Keller are there, then you need to let us know. And I see, all right, that's it. Huruna Mohammed Al-Majir, Dr. Manisha Danan. All right, let me see. I'll show you how to. I can't do it here, but let me go to the India room and open up the live chat for India. All right, so here. So for Manisha Danan, okay, Dr. Bala has just joined in the India room, so I can now actually leave, and other members of the India team can now join and chat away. Green Sadru. All right, so let me go to Tanzania and do the same. So if you are from Tanzania, all you need to do is join the room. There needs to be just at least one person. Now, if you're, it's better to have two people. Obviously, it's difficult to have a conversation if you're by yourself. But then, Green Sadru, I need you to join now so that I can entrust you with the room. Otherwise, yeah. So please click on join. There. Okay, that's it. Now I can leave and other Tanzanian scholars can join. Now, if we go to, let's see, what other countries are there? So, of course, if there's no one from the country to share, to put in a message, we won't open up the room. All right, I see Ghana. Okay. All right, and Liberia. Okay, let me see if I can open up the room for Liberians. Let me go to here. There. So if you are from Liberia, Beyanmu Peters and Rosalind Gaboki have both put in messages. So if you are there, please click on join. As you can see here, I've started and you can see the button here. So if you're not familiar with how this works in Telegram, you just need to go here. Yep, done. Okay. And then once that's happened, then I can leave. Okay, thank you, Kelvin. I can leave and we can open up another room and so on. So, of course, if there are countries for which there's no one who has time or inclination to connect with fellow members of the movement from your country, that's okay. This is really something we offer as a plus during the Impact Accelerator stage so that you can speak to each other. And I see Kenya and Ghana are already open. All right, do we have Cameroon? No. All right, well so we have Nigeria, India, Liberia, Ghana, Tanzania, and there's still some of the francophones who are going on with their discussion. So that's wonderful. With very small. So this is in a huge movement. This is actually quite a privilege to be able to have that small group discussion we all wish for. So. All right, let me see. I think. All right. India is going on. So, yeah, please click. Yep, there. And once you're on, you can actually invite colleagues. If they're already in the room, then you can invite colleagues to the room. So that's how we do it. I think, Charlotte, are you there?
Yes, sir, I'm here.
Okay, I think that's it. This, of course, is the third week we're doing it, so it looks like we're off to a good start with conversations between members of the movement from Ghana, India, Nigeria, Liberia, Tanzania, and other countries. Wonderful. So I'm just going to run through, because there's still 135 people in the room, I'm going to run through a quick recap of the Teach to Reach announcement. That's quite a significant announcement. Let me just see if I can switch over. Yeah. So first thing is Teach to Reach will be taking place on the 17th of June. So if you haven't received your invitation yet, you can request it here. That's on the Learning.Foundation website. Now, March edition of Teach to Reach had 8,584 people registered. And for Teach to Reach 6, we're pleased to announce that we have 11,097, including almost 6,000 Anglophones, English speakers. And this is on the 17th of June. For the very first time, we're opening up to health professionals outside of immunization. Big announcements is a partnership with UNICEF focused on COVID-19 vaccine demand. So as part of the global event on COVID-19 vaccine demand, we're inviting partners to join Teach to Reach Connect 6 to listen to members of the movement who are tackling COVID-19 vaccine demand. And hello to Shiba Dauda. I think, Shiba, it'd be nice if you could introduce yourself. We only know your name, and I think it's the second time you said interesting. So please let us know who you are. But for Teach to Reach Connect 6, we have 2 dates. The 17th of June, that's the Teach to Reach event, where we'll be listening to what you are actually doing that is making a difference, helping to strengthen confidence in COVID-19 vaccine and actually increasing demand for COVID-19 vaccine. And then on the 22nd and 23rd, everyone who attends Teach to Reach on the 17th of June, who is a member of the IA2030 movement, will receive the invitation to join and to participate in the event on the 22nd and 23rd of June. Other notable events for this Teach to Reach will be again on 4th of March. There's an inaugural event led by Women Who Deliver Vaccines, and this time the collective of Women Who Deliver Vaccines is partnering with the Geneva Learning Foundation with a zero-dose community practice of Gavi and Immunization Agenda 2030 Working Group 3 focused on coverage and equity to explore how again you are in practice facing and tackling gender barriers to immunization. Neglected Needs of Women's Health is the other big plenary session focused on female genital schistosomiasis, on FGS. And so that are really 2 simple steps to make sure you can join this amazing event. One is to get your ticket. Look for this email that is called Get Your Ticket, and then click on the red rectangle here that's supposed to be a button. Once you're on the Teach to Reach conference website, there are 2 steps. Click on register and then choose the ticket for English country health-based professionals. You can see the main plenary sessions here. Networking sessions. This is where you click on the button and you're connected to a fellow health professional to discuss one of these 3 themes. And then here the plenary sessions, again, in partnership with Movement and TGLF partners. We are exploring the question about the future of immunization. As members of the movement, you're helping to forge that future. The movement is now reaching almost 45,000 people. It's about the connections you make with each other. We're near, really 13 days away from the end of the first full learning cycle for Immunization Agenda 2030. And right now we've heard today, we've explored how a few of you, members in the movement, are making progress with your IA2030 action plan. We asked you a simple question. You developed an action plan. Are you ready to take action? Once again, thank you. I see many of you are enjoying the discussions with people from your country who are also members of the movement. Once again, thank you and see you Monday for the final assembly of this full learning cycle.